Nursing has a stigma of being known for rudeness. I'm not sure if we have to be nice. But now, because we get to the patient and we don't give them the time and the full interaction that they maybe expect, or maybe the patience that they expect, they then feel like we are being dismissive in our approach. The nurse-patient relationship means that you and your patient should form some part of friendship or relationship that doesn't go beyond emotions. Good morning, it's your Khululwa again. Okay, today guys, we're talking about customer service, and as in customer service in healthcare has become a bone of contention. A lot of our clients are not trusting us as nurses, and I am in a journey of redefining nursing. I am here with a course called customer service, but this customer service is not entitled customer service because we are in healthcare. So I'm saying customer service to enhance patient experience. Enhancing patient experience meaning that each interaction you have with a customer or your patient should leave them feeling like the best person on earth. Nurses have been seen or trending recently, and it's not a new thing. Nursing has a stigma of being known for rudeness, being known for unethical behaviors or behaviors that are not so nice to people. I'm not sure if we have to be nice. Do we? I don't think so. We don't have to be nice. But somewhere along our training, there was some part of our training, I think it's in ethics, you guys must come in here with knowledge and empower each other. I think in one of our ethics chapter, we have somewhere where it says nurse-patient relationship. And in that chapter, I remember we were taught about how to behave and how to relate towards our patients. One of them says the nurse-patient relationship means that you and your patient should form some part of friendship or relationship that doesn't go beyond emotions. Simplified. That doesn't go beyond emotions. And I think that is why Amanesi are struggling with forming this bond. And because we're trying to create this distant wall, which sometimes is not always possible, then we are viewed as these people that are not friendly, these people that are somehow rude. There is a thin line between rudeness and assertiveness. And I think we should reflect on that as nurses. Because amongst ourselves, there has been a lot of nurses coming on social media and screaming toxicity in the workplace. So that then tells you that there is a deeper problem in relationships within the healthcare or amongst ourselves. But again, I'm just going to relate to myself. And I think these are the things that contribute to a customer service. And these are the little things that we live on our daily lives as we work in the environment, either it being in a hospital, either it being in a clinic or wherever you are, where you have an opportunity to engage with a patient. Recently, I was sworn at by a doctor because I greeted him more than once, more than twice. So this doctor says, all you know is been greeting, you are just useless. And I had to bite my tongue so much because I wanted to tell him otherwise. But as you may know, my face told him off. But my words never came out. Why did the words not come out? It's because I had to protect the professionalism. At the point of care where this incident occurred was my patient that just woke up from anesthesia. The patient also said, "Asimshaye, sister." But looking at that scenario at that time, and I am reflecting here on customer service, I kept quiet when this doctor kept throwing a fit and throwing insults, because she was not just throwing a fit, he was throwing insults as well, telling me how stupid I was, telling me how useless I was, telling me everything else that he could capably tell me at the time. And because I was next to the patient, I did not respond. Trust me, I had a lot to say, but I did not. Because of the relationship that I should have, or the professional respect that I should present to my patient. It had nothing to do with me not being able to respond, but it had everything to do with the circumstances at the time.
So do you think the doctors also need to go for customer service training?
They do. Every healthcare worker needs to go for the trainings on customer service, because our training talks about ethics. We talk a lot about ethics. We're not talking about the practice itself. So the theory in the ethics and the business ethics doesn't come in and translate to customer service. And I'll make an example. As a nursing services manager or as a nurse manager, as a nurse on the floor, because I have gone through all these stages in the profession. I didn't just become someone who solves problems. I started creating the problems myself. I was part of the problems myself, somewhere in my career age. The nurses think they've done everything right, because I'm not selling anything, and I'm using selling anything as a general term for customer. Right? So if you meet a customer, you're looking at someone who's going to buy something from you, and you want this person to come back, and you must now treat them with the best courtesy you can. Otherwise, in healthcare, it's different. In healthcare, you are talking to someone who's vulnerable at this stage. And nurses think they are doing everything possible. And I'm not talking about someone now who's just negligent and doesn't care in their approach. And I have an example for that one. I'm talking about someone who is in the ward and who thinks she has done everything for the day. But unfortunately, the patients are not happy because of either the interaction, either the attitude, either the body language. Because somebody said, "Nanga maphilisi," and she walked away, thinking that she's talking to someone who's sound. Your mind is, you are GCS 15/15, and that's the terminology we use. If you are GCS 15/15, when I'm talking to you, I'm expecting to understand what I'm saying. But if I'm talking to someone who is not in that state of mind, then things change. So if I come and say, "Nanga maphilisi wakho," and then in your hand, you are either uzembozile ngaleso sikhathi, or you've covered yourself, and you wake up, you look at me, and you cover yourself again. Then I walk away and I do something else. I come back and awaphuzanga amaphilisi wakho, and I ask again, "Oh, bengithenanga amaphilisi sisi, ungavuka uphuze manje." Kuwe lokho, it's already irritation, as compared to someone who wants you to come back. You're not going to come and say, "Oh, amaphilisi wakho akawathatha." "Oh, ma, amaphilisi akho akawaphuzi," because you are expecting this person who would understand ukuthi uyamncenga. And it is unfortunate that we need to understand communication skills. So this translates to where you are at the time, how you communicate with the patient, and how you present yourself at the moment you're communicating with the patient. And that is where I think our problem really, really lies. That is why I'm encouraging employers to come together, and we really have to do a full-on patient experience and customer service training, because we are trained on ethics, but translating the ethics to the floor is totally different. And sometimes people are in a rush. It's not necessarily that the body language is dismissive, but it's because they are in a rush. There is a lot going on. The resources are limited. Or maybe the resources are not limited, but we are chasing time. Maybe today we are well on staffing, but we are just chasing time, because today we have got all we need and we need to get going, because we are now energetic, must be proud of ourselves. But now, because we get to the patient and we don't give them the time and the full interaction that they maybe expect, or maybe the patience that they expect, they then feel like we are being dismissive in our approach, or we are being... we're rushing them, and we're not being considerate to the circumstances. And just yesterday, I saw another post from a lady, Polar Park Clinic was trending, because honestly, mama took a child with a foreign body in the nostril, and they could not visualize the foreign body, and actually told the mom to go and gave them the antibiotic. After giving them the antibiotic, the mother comes back because mother is bothered. Again, when she gets there now, they talk amongst themselves, but mama can hear them, which then goes back to communication skills, because this lady can hear them. And now she's getting annoyed and irritated because it's It is made to feel like yena agasile ekhanda. Yet she is very much aware of what is going on, and she's trying to get help and seek help, but she's being dismissed.
So what was the nurse supposed to do in that case?
The nurse in that case was supposed to communicate better and say, okay, ma, at least say, okay, I cannot visualize this, because also, according to this lady, it seemed like they didn't have the right equipment to visualize the foreign body, and they used a torch, your cell phone. So communicate better. You know what? I cannot visualize this. Let me ask you, Dr. Uti, if she can see. And then the doctor came. Also, she could not say it. When they could not say it, they were supposed to refer. They can't see it, and it's not that it's not there. Umntwana uyakhala, there is pus coming out. There is an indication, clinical indication that something is wrong, even if it was not a foreign body. But a referral system could have now eliminated the trauma that the mother and this child had to go through, because they could have just referred to the next hospital or closest hospital. The hospital has better equipment. The hospital has got specialists. If it's not something that they can manage, there are ENTs there, the people that could look better. There are senior doctors there that could look better and examine the child better and maybe see. Now an X-ray was done. A few days later, this child has now stand a chance of being of sepsis, because now the foreign body was stuck there for a few days. And it has to be visualized through X-ray. And now when it's visualized through X-ray, now umama still feels like kusho ukuthi mina ngiyasangana, because I've been here and you've been telling me ukuthi no, there is nothing. So what went wrong there in terms of customer service? It's communication. It's the level of dismissiveness, the attitude that was given to this mother. Because for her to be persistently and consistently going back, she was in trouble. She could see that there was something wrong. But because the service providers did not have the mental capacity at the time or the professional maturity at the time to actually accept that they cannot service this kind of issue that they have at hand, they must now escalate it and send it to the next level where it could be investigated better, where it could be handled better. Then they now fail to this parent. But now who cares? The whole thing becomes, unesi said this, unesi did this, doctor said this, doctor did this. They did everything else except the right thing. The right thing was, we can't see anything, Mama, we are sorry, we are going to refer. First time, they suspected it was nothing. Maybe let's forgive them. They gave an antibiotic, went home. Mama came back at night, because now the very same people that were treating me said there's nothing, but now when I'm at home, I can see there's a problem. She comes back. The first question she's asked, why are you here so late? Nivulele nigand. Why are you opened if people shouldn't come? Exactly. Then it tells you that there is a problem with how we see ourselves as well. Because if you are there at the time that you should be at home sleeping, and you are at a place of service, but also you don't want people to come, so why are you there?
That's an interesting question. You know, you said something about the nurses calling other doctors to come and also examine the child because they couldn't see anything, right? Where do we draw the line for patient, doctor, nurse confidentiality if more doctors, I understand more doctors are called in, but where do we draw the line where the doctors are, there's 5 doctors in one room to examine my child, it's very uncomfortable maybe. For example, they all can't see anything, and then they sign off, okay, Sissy, we can't see anything. There's 5 of us who can't see anything. Instead of doing the right thing of saying, like you said, referring the person. Where do we draw that line for confidentiality? Because this is so lapha kuJonas, udokotela watshela umfazi kaJonas ukuthi umfazi omunye ubeletha amawela. And then I don't know if that's allowed even if we're in the same family.
Okay, starting with the serious one. So the child is here seeking help. I can't see anything. So there is no confidentiality breach, because these are all clinical teams. These people are here and they are qualified to help me, because we are helping now. It's an extra eye, which is safe practice. Okay, so there is no confidentiality breach. It's unlike phoning, taking a phone, ufonela omunye ose Tembisa Hospital and say, hey, I have someone here, so that is now one, the tone is different. You are no longer sharing clinical you're not seeking clinical advice, you are now gossiping because you are one in the. But if you are calling for help, even if you call outside and say, hey, I've got someone here who has a foreign body, or the history is that there is a foreign body, but I cannot visualize it, I cannot see it, I've tried to look, I can't see it, and I don't have any other thing to use here. Can I send the patient across to you so that you can help me? That's a totally different. You're seeking help. You're seeking advice. It's still clinical guidance. You're escalating care, right? You are avoiding negligence because now there is negligence here. But Ujonasi and the doctor that says, oh, Sawubona, you are here. By the way, umfazi wakho ubelethile ngale. Njani? Are you talking to Jonas because Oyamazi, you know Jonas as a person, or are you talking to Jonas as a client? Why was Jonas here? Why was Jonas not here? Was it because usemsebenzini and maybe he came late? Are you telling Jonas ukuthi abe excited that, oh, by the way, you have safe landing?
Oh, bebatshela umfazi waJonas ukuthi uside chick ubeletha abantwana lapha.
So that is confidentiality breach, because when I as a doctor ungena kuma side chick nabanye bazi. How do you know the relationships here? You are even compromising now is safety yalo obelethile because you don't know ukuthi lo uzoreact kanjani. Yabo. You don't know the relationships, not unless we're talking about themselegus. Themselegus are known ukuthi hayi yabona iqembu lami leli, it's okay. So if you tell umakhumalo ukuthi umangwabu belethile, probably she will be excited and be like, oh, by the way, ubengijelile and I'm actually here for that. Yabo. It's unlike ukuthi uzothi ukhuluma ngani and then it now causes a conflict because now you're introducing a conflict to this family structure. You have no business discussing indaba zabantu as a healthcare practitioner. No, it's unethical. It's just not right.
Okay. So manje, even if the same people from the same house baza kudokotela wonke abaphethe STIA1, and there's one of them who's normally your patient who hasn't come in, you can't call them and say, "Sisi, go check lapha," but not tell them what's happening.
That is a catch-22 situation. You know them, right? That's what you're saying. So this family is known to you. They are your clients. So you have a right to ask main character kule family. So now you've brought the 5. Where's the number 6? Because that compromises a treatment effect, because I'm going to treat all of these. Law ongeko will still remain untreated, and you're still going to go back to that one ongeko for reinfection, and then now it's going to be a reoccurring case. So mawubaletha abantu bakho we Jonas balethe bonke, including yourself, and tell the truth. Yes.
Okay, another question, right? Lenacapavir, if I've said it correctly, the new HIV vaccine that came in is targeted for kids, sex workers, and I think people who are vulnerable to get that infection, right? How do they plan on getting it to sex workers? Are they good? Remember, normally in the townships, you'd have like a truck where you can get tested for HIV, hypertension, diabetes, cholesterol in that truck. Are they going to use that same method for lenacapavir for those who want to come get it without showing, especially because of the conditions that sex workers are working under?
I don't know, because now that compromises the sex worker, because now everybody knows. What if abantu abazi and I am the elite sex worker? Because if I'm the elite sex worker, I only do that essenting, for an example. Ngiyenza nabantu aba-rich in a certain place, but ngihlala elokishini. So ekuhlaleni kwami elokishini, and the truck comes, and then manje sengiyalaphaya when uMpopo was saying ufuna abantu aba.
So manje is it impacting customer service?
It does. It will definitely do, in a sense that Mina, if I were in that campaign, I was not going to specify. Yabo? I was not going to specify because that already discriminates the societal issues that are there. We know that the target is, right? So, ngalesikhathi ngisamemezela, I will not memezela or and say emphakathini ngifuna bonke laba abasebenza lo msebenzi beze. Chances are kunamuntu ozuza. Rather mangimemezela imtholampilo uzobe ukhona omahamba nendlwane, which means mobile services will be there providing prep wonke umuntu o interested. Because already the campaign has been out there, communication has been out there that Lenokapeve targets this kind of person or this kind of people at this stage. So if my priority is to get a good response, I then will not be able to say that to the community because chances are akekho umuntu ofuna nazi ukuthi usebenza lowo msebenzi. Like, honestly speaking, nobody wants. Nami ngiyimi nje ngingawusebenzi lowo msebenzi ngunes. Probably there's an opportunity to do it because emsebenzini yabo. But I cannot now go and say, hey, mina ngiya. But the campaign to be successful, I need to be strategic about it. Call everyone, have AMA rooms, kuzoqalwa ngapha, so that in this room, it's screening room for criteria. So when I'm saying qala ngapha, a clinic, you know, ukuthi kuqalwa ngapha uthatha ama observations, right? Then you go to the right place. Qala ngapha kuma observation, and then in the observation room, there must be a chart for the criteria for screening room. Ukuthi ngibuze the right questions. Sisobabila ngithi uzongitshela mpintsha. It's just the two of us. Uzongitshela, you will be comfortable now. You will share with I know mina, I feel I'm vulnerable because 1, 2, and 3, because 1, 2, and 3. And then ngiyabhala laphaya and then I direct you. As compared to ukuthi sizothi sihlalele laphaya ukuthi abethi bingala, abengculaza ngala. It's unfair.
But do they still do that? And I haven't been in a public clinic since I had my son. Do they still do that thing? Because I know the pregnant ladies go that way. Family planning goes that way.
Endaweni yangakithi nje emphakathini wangakithi ayisekho le discrimination. Is not that obvious. Ikhona, but it's not that obvious. Yabo emntwini, well, eclinic wonke umuntu uyaziwa. Mawuphethe leli khadi siyazi uyapi. Yabo. We know because waphethe nathi. So it's nothing ukuthi ayikho into efihlwayo lapho siyazana, siyashebe. Aneke emakhaya kumnandi kabi siyashebisana ngale shandisi. You give me yami phelile mfethu angakayi ongizami. So you give me ne. So we know each other in the community. Uthi awuyadla sibanibani uzokuncanzela. Yabo. So coming to a clinic where you think confidentiality might be compromised, emphakathini wangasekhaya it's not that obvious because ama rooms ahlukanisiwe but chronic uhamba wonke. So if you are nama chronic nonke, you go in the same room. Aguna guti when you are coming for ETB treatment, when you are coming for HIV treatment, when you are coming for antihypertensives or whatever else that needs to be, or diabetics for chronic treatment, everything goes into the same room.
But you still say it when they put those mobile clinics, it's impacting customer service, right?
Yes.
But normally those mobile clinics are labeled HIV, AIDS, what? Is it still not impacting customer service, even though they are there and they're working, where people go into the container and when people see you in the container and you've been losing weight, AIDS, you know how it's like, mawakubona ukuthi yo umncane plus akasedli ukuthi uyaphela nje yamphela i-AIDS.
It does, but I guess we are at a stage now where we need to really understand that a confidentiality, you worrying about umphakathi seeing you going for your treatment versus your health. You need to really weigh your options here as an individual now, because what would be wrong then is for the nurse to talk about you as you come in or as you walk out. But if it's a service container, because remember, some areas don't even have clinics, and a service container or a clinic that requires someone to come for a mobile service that has just been visiting for a day, it's important that the person who goes in there understands ukuthi uyelani nawe, but it doesn't breach confidentiality. Ibhaliwe vele because it's a campaign, it's a motivation. And masiya sonke sibaningi, you are not worried ngoba phela awuzuthi musuphuma lapha yasesiyazi ukuthi kwenzakalani. That is what I'm saying. If your nurse is then saying, oh, udlule ngapha uthatha amaphilisi akho-ke, then that's breach, because now useyamemeza, yet you are here. You are at the proximity of a normal voice or normal conversation. There is no need to memeza. And even if usekhohliwe, let's just say the service provider forgot something and she wants to tell you, there is no need that she must now shout what she wants to tell you. She can just say, sorry sis, can you come back kancane ubuye usondele and come to the proximity that she can tell you what she needs to tell you without everybody else hearing it. Because some conversations needs to be really intimate. And intimate meaning, intimate means ukuthi into yethu encane yomndeni yabo sisoyithula siyazwana, we're talking about what we're talking about. Otherwise, if then it needs to ukuthi communities should now shy away from going there because the container is labeled HIV and AIDS, uzogula and uzogula wedwa, umphakathi lo osabayo will support you ngamahewu. I think that's enough for today.
Definitely.
I've said enough customer service. But what is important and what I want to share with our communities as a healthcare professional looking at the polygamist and the trending polygamist, I have seen abantu reviewing it in a way that it triggers a lot of women. It does not trigger a lot of women as our reality revived. That the reason it is our reality revived. We have lived with Abu Baba Abanestembo. We have lived with the honest Jonases that are just Jonasing nje, and they are moving with it. But women have accepted and suppressed this in a sense that it has been normal. Uzoza kuthiwa emshadweni kuyabekezelwa, and the only thing that you need to bekezela ukuthi uJonas umkile. So if uJonasing is running away and she's busy, akaJonas nje kuphela, he's busy. He's gonna come back one day ephethe amasi because that's the only thing he could buy, and gonorrhea because that's the only thing he could collect for you. It's important really that we look at this Jonas thing and associate it with the availability of UPrEP. If we can't do anything else about the rest of the STI, at least don't get HIV. And that's my take. And I'm an honest healthcare professional. I am saying to you, you have Elena Kapeva, you've got UPrEP wamapilisi. If you can't do anything about uJonas wako, because probably you won't even be allowed to request a condom, and you were sitting at home being an honest woman, and you have this Jonas who is busy Jonasing, do yourself a favor, woman at home. Ambueta to PrEP twice a year. Lena Kapeva, twice a year. Thank you.